Hello everyone. Today's class we are going to discuss about breast disorder. Okay, which comes under unit 10. So let's start. First we are going to see the classification of breast disorder. In female that there will be two categories. One is nipple disorder, one is breast infection. The first one is nipple disorder. Again it has three types. One is inverted nipple, okay, one is retracted nipple, and one is accessory nipples. The first one is inverted nipples. What do you mean by that? It is a condition in which nipple, instead of pointing outwards, get retracted into the breast. You can see in the picture what happened. Instead of the nipple, should come outside, but it is going inside, retracted into the breast. That's why it is called inverted nipples. And the methods, like how that this type of woman can feed their baby: use of breast pump, hospital grade electric pump, use of nipple shield, and frequent stimulation. This is the picture of breast pump, okay, that used to like accrete the milk from the breast in case of inverted nipples. This is the picture of nipple shield. Other methods to treat it like this, like plastic surgery, nipple piercing, regular stimulation, suction cup or clamps, or homemade nipple protector. So these are the other method that women can feed their baby in case of inverted nipples. Next we have cracked nipples. The definition: it is a condition in which there is a loss of surface epithelium with the formation of raw area on the nipple, along with fissures situated either at the tip or at the base of the nipple. Okay, and cause: what cause cracked nipple? Improper hygiene resulting in crust formation, retracted nipples, trauma due to incorrect breastfeeding. So this is the example or picture for cracked nipples. You can see how it is, how it looks. Symptoms: how they'll know that it is cracked: painful breastfeeding, and it may progress to the mastitis. Mastitis means infection of the breast. Okay, and that how to do the maintaining hygiene, and the treatment is correct attachment of infants, purified lanolin application 3 to 4 times, uses of breast pump and shield if severe, application of miconazole lotion, and biopsy. So it is depend on the cause. We have to plan for treatment. Now we'll study about the breast infection. Okay, so it has two types. One is mastitis, one is subaerular abscess. So now we'll see one by one. First one is mastitis. It is the inflammation of parenchyma of the mammary gland. Okay, itis means infection. So mastitis means infection and inflammation of the breast. Okay, so it has two types. One is pueperal mastitis, one is non-pueperal mastitis. Okay, pueperal mastitis means if it is occurs only after the delivery, during the postnatal period, that is pueperal mastitis. But if it is occurs like without delivery, simply like normal times, that it is called as non-pueperal mastitis. Okay, so what cause mastitis? Like what are the bacteria is responsible for causing mastitis? That is staphylococcus, streptococcus, gram-negative bacilli such as Escherichia coli, salmonella, mycobacterium, candida, and cryptococcus rarely. So these are the few pathogens which can cause mastitis. You can see the picture. In case of mastitis, the breast will be like this: infection and inflammation. Next, we will see the causes for pueperal mastitis and causes for non-pueperal mastitis. So the pueperal mastitis, first one is blocked milk ducts, milk excess, cracked nipple, tight clothing, microorganism transferred by the patient and infant. And the non-pueperal, hyperprolactemia, thyroid disorder, breast trauma, and any surgery, and nipple piercing and medication. Now we will see the symptoms for pueperal mastitis and non-pueperal mastitis. For the pueperal mastitis, there will be a tough and doggy texture, dull to severe pain, flu-like symptoms, and abscess. For non-puerperal mastitis, there will be redness, swelling, diffuse tenderness and pain, hot spot, and abscess. Next, we have treatment. For the puerperal mastitis, first breastfeeding, use of suction device, heat application, cold compresses, and antibiotics. For non-puerperal mastitis, symptomatic management based on the symptoms, we have to treat the patient and the broad spectrum antibiotic to prevent the infection. Okay, so this is about the mastitis. Next is breast engorgement. The first we have definition. It is a condition which occurs in mammary glands by expanding veins and the pressure of new breast milk contained within them. Okay, so cause it due to the exerted normal venous and lymphatic engorgement of the breast which preceded lactation. It involves primiparous women and women with inelastic breast. This is the picture of breast engorgement. Symptoms: pain, feeling of heaviness, generalized malaise, transient rise of temperature, and painful breastfeeding. And how we can prevent breast engorgement? To avoid the placental pre-lactal feeds, to initiate the early and unrestricted breastfeeding, exclusive breastfeeding on demand, and feeding in correct position. Management: to support the breast with braziers and manual expression of any remaining meal after each feed, to administer analgesic for pain, put baby on breast, feed regularly and at frequent intervals, and gentle use of breast pump if it is severe case. Next, we have one complication of postnatal, that is failing lactation, means mother is unable to feed the baby. What cause the failing lactation is deliberating state of the mother, early primigravida, failure to suck the baby regularly, depression or anxiety state in the puerperium, okay, apprehension to the nursing, premature baby who is too weak to suck, and painful breast lesion. Management: during the antenatal period, educate the mother regarding the advantage of breastfeeding, correction of abnormalities like retracted nipples, and maintaining breast hygiene, improve the general health status of the mother. And during postnatal period, encourage the adequate fluid intake for the mother, nurse the baby regularly, treat painful lesion promptly, express the residual milk after each feeding, and drug like thyroid extract or prolactin are useful. So with this we have completed the breast disorder that is associated with the postnatal period or puerperia. Thank you everyone.